From WFAA-TV, the spirit of Texas. This is Good Morning Texas in high definition.
Amy is standing by, talking about the issue of chronic fatigue that may just be more than just the result of a busy lifestyle. Amy?
All right, Gary, thank you. Well, fibromyalgia can be debilitating. Extreme fatigue, widespread pain, and difficulty sleeping are a few of the symptoms. Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center, says this ailment is not a disease but a sign of an underlying cause or condition. Welcome back, Dr. Hotze. Good to see you.
Glad to be back, Amy.
All right, let's start by discussing exactly what fibromyalgia is.
Well, fibromyalgia is a constellation of symptoms primarily associated with severe pain in joints, in the neck, in the elbows and the knees, tenderness, just tenderness of the skin, general chronic throbbing muscle aches and pains. And it's associated with fatigue, and not just mild fatigue, exhaustion, and sleep disturbances. Those three are the constellation that would be considered fibromyalgia. But that's not a diagnosis. That's just the description of the symptoms. As a matter of fact, the term, many women go to the doctor and say, I've got joint muscle aches and pains, I ache all over, I can't sleep well, I'm fatigued. They run a battery of tests and say, you got fibromyalgia. You know what fibromyalgia means?
What is that?
It means joint and muscle pains. So in Latin. So you go to the doctor and tell him I got joint and muscle pains. He goes, well, you got fibromyalgia. What does that mean, doctor? Joint and muscle pain in Latin. I went, well, I told you that. The question should always be, why do I have these joint and muscle aches and pains? Why do I have a sleep disturbance? Why am I fatigued? What's causing the problem?
So there's always that's a symptom of an underlying condition.
Always ask why. If your physician tells you a diagnosis, say, why do I have that? Get to that. So what causes fibromyalgia? Well, fibromyalgia is associated with significant low body temperature. Basal body temperature is low, and low metabolic rate. Well, low metabolism, low metabolic rate, exhaustion, joint muscle aches and pains, sleep disturbance, depression, which is associated with it, weight gain, sluggish bowel function, poor mental function. What do these sound like? Well, they're classical features of low thyroid, hypothyroid. Now, the thyroid gland in the neck produces thyroid hormones, which govern the body's metabolism. So if you don't make enough thyroid hormone or can't properly assimilate thyroid hormone into your cells, guess what? You get these constellation of symptoms. And so most physicians will run blood tests and say, well, your blood tests are normal, dear. I think you have fibromyalgia. They'll give them analgesics, pain relievers, sleep medication, antidepressants, but they won't treat the underlying problem because they miss it. And the way to find out what the underlying problem is basically get a doctor who understands the symptoms of low thyroid, and that fibromyalgia in 90% of the cases is caused by low thyroid, and the treatment would be thyroid supplementation. You replenish the thyroid, and we use Armour Thyroid.
And then those symptoms of fibromyalgia tend to go away with the condition.
Absolutely, because you treat the underlying problem. And also you can use natural female hormones, because we see these problems in fibromyalgia occurring primarily in women. Guess what time of life it happens? In midlife. 30s, 40s, 50s is when they get these problems. And that's when their own natural sex hormones begin to decline and become imbalanced, which adversely affects their thyroid hormones. So it's a very simple problem. If the gas in the tank goes down, fill the gas tank back up. When your hormone levels go down and you have these symptoms, this constellation of symptoms that are described as fibromyalgia, or some doctors describe as chronic fatigue syndrome, treat the underlying problem. It's not, you don't have these symptoms because you have low levels of drugs. It's because you have low levels of hormones because you're getting older.
And why do physicians so commonly overlook the symptoms of hypothyroidism?
Well, because they rely strictly on blood tests. And it's interesting, the blood tests on thyroid disorders there's no correlation with the symptoms. So a woman can come in with all the symptoms of low thyroid, and if the doctor takes the blood test and it's in the reference range of normal, he'll go, well, I guess you don't have hypothyroidism, you have depression, which he'll give her antidepressants, give her sleep medications. So the poor lady ends up on drugs, but her condition is really low thyroid, and the doctor has missed it because
he's treating the symptoms.
He's treating the symptoms.
So what would you recommend?
We use, in our practice, natural thyroid, which is Armour Thyroid. We don't use the synthetic thyroid at all. The reason I don't is, in our experience, we haven't found that people do well on that. Now, some people may do well, but the women we see and the men we see in our center in Houston just don't do well.
No.
Not on the synthetic thyroid. So we use the natural Armor thyroid.
Well, what final thoughts would you have to our viewers if they are interested by what you've said today?
Well, if you've gone to your physician with a constellation of symptoms and he runs your blood test and tells you basically everything is normal, it makes you feel like you're a hypochondriac or hysteric or neurotic, then maybe you need to look elsewhere to a physician that can take a listen to your problems and understand that those constellation of symptoms really indicate that you have an underlying problem of low thyroid and is willing to treat you with a clinical course in a clinical trial of thyroid.
All right. Well, Dr. Stephen Hotze, great information today. Thank you so much for being here. All right. You can find out more about hypothyroidism by contacting the Hotze Health and Wellness Center in Houston. That number is 877-698-8698. And check out their website at hotzehwc.com. All right. We'll be right back with Rodney Anderson from CTX Mortgage Company. He's got the latest on the new rules.